Tuberculosis is a preventable and curable disease, yet some 270,000 people in the Americas contracted this disease in 2015, and some 50,000 don't even know they have it yet. It is the world's top infectious disease killer. Here in Belize, TB is listed as one of the leading causes of deaths among HIV-positive persons in 2015, accounting for 35% of those deaths. Even as a global epidemic, particularly in developing countries, there are still misconceptions surrounding this disease. And so today is a day set aside to raise awareness and call for action to end TB around the world.
Some of the common myths would be that people think that once you have tuberculosis, you're going to die. Also that you can easily transmit tuberculosis by patting somebody on the back. That if you have tuberculosis, you should quarantine the individual. So stuff like that is what we would be normally hearing in the community. However, like I said earlier, our role is to clarify those myths, demystify tuberculosis, and so we're increasing our awareness to tell people that if you have tuberculosis, you can get screened and you can receive treatment and you can get cured.
Poverty, malnutrition, poor housing, and sanitation, compounded by other risk factors such as HIV, tobacco, alcohol use, and diabetes, can put people at heightened risk of TB. According to the Ministry of Health, groups most vulnerable to TB also include children and the elderly due to a weaker immune system. But in the most recent screenings, a large number were men. The ministry's records show that 260 new cases were diagnosed in 2016, and 36 of those were diagnosed in HIV-positive persons. Last year also recorded 20 deaths from those newly diagnosed.
The Ministry of Health did about 638 screenings of tuberculosis. Out of those, 120 were confirmed cases of HIV, most of them being pulmonary tuberculosis. Like you said earlier, we had some deaths of tuberculosis. We also have about more than 50% of those persons currently on treatment. Most of these deaths indeed are HIV-TB co-infections, because 1 in every 3 persons that has HIV tends to develop tuberculosis, which is why it's very important for persons living with HIV to get screened for tuberculosis, and if they have the presence of the bacteria in their system, to start prophylaxis treatment, which gets rid of the bacteria and then it prevents them from developing tuberculosis later on. Also, not only HIV, but diabetes is another chronic disease that can increase the prevalence of people developing active tuberculosis.
TB is an illness caused by bacteria. First, it is latent or asleep, where just the presence of the bacteria is in the system. But then it later becomes active as a disease for different reasons. So when this happens, it is important to pay attention to symptoms, get tested, and take the treatment. In Belize, testing and treatment are available at just about every health facility, and it is free of cost.
There's a latent infection and then there's an active disease. So whenever somebody has a latent tuberculosis infection, it means that they have the bacteria in their system, but their immune system is healthy, that it's keeping the bacteria controlled. So let's say whenever somebody develops diabetes or contracts HIV, then they would start developing the active disease. So when that happens, then they start developing symptoms like a cough for 2 weeks or more. Sometimes there is the presence of blood within the phlegm. They have fever, evening sweats, weight loss, loss of appetite. These are the normal symptoms that we would look for. If you have latent tuberculosis, which means you have only the presence of the bacteria in your system and not the disease, then you will start getting prophylaxis, which is preventative therapy. So prophylaxis lasts for 6 months. All right. Now, if you have the active tuberculosis disease, if you're somebody not infected with HIV, then your treatment is only for 6 months. While if you're somebody with HIV, then your treatment goes for 18 months. And the reason for that is because you get 7 months of therapy, which actually gets rid of the bacteria, and then you take the additional months as preventative therapy for you to become infected, for you to prevent from becoming reinfected with tuberculosis. Because it does not mean that you get tuberculosis now and you get cured, that you will never catch it again. There's still the risk if you have exposure to it that you might develop tuberculosis later on in your life.
Just as TB is curable, it is preventable, but because of the ease of transmission, it continues to be a major health concern for Belize and across the world, where it claims 5,000 lives every day.
Keep a healthy immune system. Eat healthy, exercise, manage your stress. Keep a healthy immune system. Also, there's basic coughing techniques you can do. If you're gonna sneeze or cough, you can do it on your sleeve, on your shirt, and if you do it on your hand, just use hand sanitizer. There's masks you can use to prevent you from sneezing or coughing into the environment. And if you come to the healthcare facility, then they give you masks as well, which prevents you from, putting other people at risk.
How serious is the picture of TB here in Belize? Is it of concern to the ministry?
Yes, tuberculosis is a public health issue globally, especially because TB claims about 5,000 lives daily across the world. Last year we might just get 120 cases diagnosed, but theoretically, one individual has about 10 contacts. So if you do 120 and you do that times 10 for the contacts, you're putting a lot of people at risk. And because of the ease of transmission of the bacteria, then it is a concern in Belize.
Reporting for News 5, I'm Andrea Polanco.